Tony was diagnosed with multiple myeloma in 2013. In this episode of Dialogues and Multiple Myeloma, he discusses his diagnosis experience with his oncologist, Dr. Peter Voorhees.
Dr. Voorhees, as you know, in 2013, what really brought me back into the emergency room was one morning. It was actually September 14th of 2013. I was 1 a.m. in the morning getting out of bed, and as I placed both of my feet onto the floor to stand up, my back collapsed. I fell back onto the bed, screaming in agonizing pain. And my partner, Julian, he calls 911 services, and ambulance comes and whisks me away to the hospital, and my back is really spasming uncontrollably, like I'm in severe pain. The nurse is asking me questions, and I still feel like I wasn't getting no blood work, no labs, and I think they were just more focused on the pain. And they gave me some pain meds and said, okay, you can get up and you can walk out now, you've been discharged. And I was like, discharged? I'm having back spasms, I can't physically walk. And so my partner, who is a physician, he asked to speak to the ER doctor in charge, and he said, can you do a simple CT scan on him? He may be discharged, but he's not going anywhere. And so once they did a CT scan, they came back immediately. And that's when the doctor said, we're admitting you to the hospital. You have lytic lesions throughout your entire body. And that's pretty much how they left it. But the look on Julian's face, I knew something was wrong. And I immediately asked him, do I have cancer? And he did not respond. And he was like, they need to work you up first. And so as I'm getting worked up and then I get the CT scan, he was like, you have a fracture of your L1 and your L3. And I was in disbelief. And then as I go upstairs and I'm admitted, a few hours later, now I'm in complete renal failure. I have a hemoglobin of 6.8, so I'm anemic. And it just kept going on and on and on. Now I have a fracture of my L4. I have another additional fracture. It was a lot from a patient standpoint. I still get choked up about it, even thinking of it, because I'm one of those patients who was misdiagnosed.
No, this is not an unusual situation for patients, unfortunately. As you know, multiple myeloma can destroy bone, and spontaneous bone fractures are a consequence of that. So patients coming in with the sudden onset of back pain for no good reason. And for you, who was at the time, otherwise young, healthy, physically active, this back pain story just doesn't quite fit, right? So you guys did the exact right thing to push for additional testing because, you shouldn't be having that pain. So you did the exact right thing. But unfortunately, this is how many patients with newly diagnosed myeloma present and are diagnosed. These spontaneous compression fractures of the spine leading to incapacitating back pain, fractures in other parts of the skeleton, for example, kidney failure as a result of high antibody production by the myeloma cells, anemia because the bone marrow is just overrun with disease. So what we really want to do is to be able to identify this earlier in the game, diagnose people when they're not suffering from all of these setbacks related to their multiple myeloma, so we can onboard them onto therapy appropriately before catastrophe strikes.
Following his diagnosis, Tony was able to access resources through his oncology care team that helped him navigate the early days of his diagnosis. Next up, Tony and Dr. Voorhees discussed some of those resources.
That really led me to support groups, as well as being able to have that peer-to-peer education and having social workers as well to kind of walk you through the paperwork and all the in and outs of it. But I think the support group was very helpful to me at some point, but then I felt like a support group was something that wasn't helpful for me, only because a lot of them started to go really negative, and I didn't want to be a part of that. But support groups was great.
It's absolutely critical, that all healthcare systems have infrastructure in place, to help, cancer patients, navigate their new diagnosis. And I think at Levine Cancer Institute, we've gotten better over the course of time in that regard. To your point, support groups are very helpful for many patients when they're kind of trying to wrap their brain around their new diagnosis. Not for everybody, but for some folks, extremely valuable. We know that a lot of the drugs that we use to treat multiple myeloma, in particular the oral chemotherapy drugs, can come with very high copays. There are many copay assistance programs out there. Leukemia Lymphoma Society is a good example of that, that we can leverage, to take some of the financial sting out of the treatment for our patients. And the supportive care services are absolutely critical, especially for someone who's sustained multiple compression fractures to their lower back. And, again, we have, a very robust supportive care oncology group in place now that's able to help patients kind of navigate, those initial experiences and the pain management that's sometimes critical for patients with newly diagnosed myeloma.
Yes. Agreed. Yeah, your team is absolutely on it now, fully aware, really supporting and helping patients like myself. Again, I feel like I am the luckiest cancer patient to have world-renowned research doctor as yourself. And you always, you hear me say this multiple times, I don't make any secrets about it. You know that I love you, and I say it again and again. I have no issues in saying that because I feel like without your knowledge, your care, and you being there for me, not only as my oncologist, but as a supportive friend also, it really helps me get through a lot of my day-to-day. When I'm not having a good day or struggling with something, I can always reach out to you and you provide that support. So that resource just from you alone means so much to me.
Stay tuned for more episodes of Dialogues in Multiple Myeloma.